Hello and welcome back to Holistic Keys to Health. My name is Bolanle, your mental health and nutrition advisor. On this space, I share insights on mental health, nutrition, and evidence-based psychological interventions that could help you improve your holistic well-being. I'm still in the Autism month, and as I promised, I'll be sharing a lot of insights regarding autism. So today I'll be talking about 12 signs of autism in a child. 12 signs of autism in a child. We'll see if this resonates with your child or your neighbor's child or a child in your school. Just listen to all the 12 signs I have. Sign number 1, not responding to a name. Now this is a very classical sign, very classical. Most children on the spectrum usually start off with that problem. You call your child does not respond to you, and you're concerned. What could be going wrong? Why is this child not responding? Some parents just think, oh, she's just selective, she's just in a world of her own. My child is very independent minded, she responds only when she wants to respond. No, that's not it. Your child is probably showing early signs. So the typical reaction of the child when they finally get to understand that name is associated with them, it's like an associated form of learning. They can identify, they can associate that name with themselves. They know that is their name because each time you look at them, you talk to them, you call them by this name. So eventually they're able to associate that name with themselves. So it's something you should take seriously. Number 2 is delayed speech or echolalia. Delayed speech is when the child is not communicating as much as they should, according to the child's age. According to child's milestones, expected that, say, a 2-year-old should have about 200 words in their vocabulary bank, or let's say 100 to 200 words in their vocabulary bank. But your child is still struggling with just about 10 words at the age of 2. Then there's something off about it. Don't take it for granted. Don't say, oh, this child is just, yes, your child could just be a bit slow, but it could need support, and you should provide that support for your child. Now this does not mean that your child is autistic. There's so many kids with delayed speech, and you only need to just check out other things. It's not just about it. So just listen on to the end. Echolalia is when a child repeats a particular thing or a sound over and over, and then this child does not attach any meaning to that sound, but maybe he heard it somewhere and he's just saying it. And let's say he hears something, someone says cup of tea, and then he just keeps saying cup of tea, cup of tea, cup of tea. Or you tell your child, go bring the blanket, and he keeps saying blanket, blanket, blanket. So your child is not attaching meaning to the word, and it's just repeating this phrase over and over because that's it's just stuck in his or her head like that, and it keeps repeating those words. So echolalia may not be totally bad. That's how my own impression of echolalia. It's not totally bad because most children usually start from echolalia before they start to advance in use of words. But when your child at the age of 4, 5, that should really have advanced in the use of language, is still on the echolalia stage, then you know that there's something wrong. You should have moved much further. That child should have moved further into using words properly. Please note that some kids on the spectrum, with time, they improve on speech or communication, use of verbal communication, while some never do. Some grow into adulthood and are still non-verbal. It happens. The 3rd sign is that your child is hypersensitive or hyposensitive to sensory stimuli. Now, what does this mean? Being hypersensitive is overly reacting to something, while being hyposensitive is underreacting to something. So if you're overly reacting, so these children are either overly reacting to sensory stimuli or underreacting to sensory stimuli. Now let me explain how this works. So we're talking about the 5 sense organs. Basically we have about 8 senses right at the moment, but I'm going to talk about the 5 major ones that we are all aware of: the sense of hearing, sight, smell, taste, and touch. Your child could be oversensitive to, for instance, sound. Something that you hear that sounds very normal to you, your child could overly react to it because it sounds very loud to your child. It sounds very disturbing to your child. It could also be a heightened sense of smell or taste. They do not like certain taste of food or texture of food, and you see that they prefer to take salt. Some children prefer to take light food, something like cereals, much more than food that they have to chew over and over before they swallow. Some children are so sensitive to light that they overreact in really bright places or overreact in dark spaces. So your child could be reacting so strongly to light, or not even reacting to light at all. Some children will hear the honking of cars and not even respond at all. You can hear your name, for instance, and not respond. Some children have tactile defensiveness, where anything on your skin feels like a razor blade is tearing on the skin. That's actually how they react to it. And you find them, even the tag on your t-shirt, on their t-shirts, is so uncomfortable they have to cut off the tags. Or even a hug, they don't like to be hugged, while some like to hug everyone. So those are sensory seekers. They're the ones looking for how to touch everyone. They just like to touch, hold people, hold. And sometimes this might be seen as inappropriate behavior. They are on the way, you're outdoors and you're hugging just anyone that comes close to them. It can be uncomfortable for strangers, really. But when they understand that it is autism, or they understand the pattern with children, then with time these kids get to adapt better. And then that is because you have been able to identify the situation as not being their fault, or as being their way of life, or their way of doing things. And then with time they can adapt to a different way of doing things that the general society would probably feel more comfortable with, just with time. Okay, number 4, children on the spectrum, you can find them obsessively playing with toys. Sometimes they stack toys, sometimes they line them up like on a tray, like a train track. And sometimes you see them holding on to certain things, maybe not even toys. It's like an obsessive compulsive behavior. You find them holding on to certain things for so long, maybe a textbook. You find them reading at odd hours. So they're always playing with something or holding on to something obsessively. Like you think, why the same pattern all the time? So that is part of their repetitive and restricted behaviors, as I explained in the last video. Number 5, they have poor eye contact and show very little interest in human interaction. You wonder why your child does not like to play with other kids. You're wondering, why does she like to play by herself? Initially they think, oh, she's just independent minded, or he is just independent minded, but something tells you inside you that there's something wrong. Why is my child not typically behaving like other kids? So this is where social integration comes in. When in the last episode I mentioned social communication and social integration as one of the signs, one of the characteristics of autism. And so social integration is something like that. The fact that your child cannot properly socially integrate with their peers. They find it easy to be by themselves. Number 6 is loss of awareness to danger. It happens a lot. You find a very ferocious looking animal, like a dog, a very dangerous looking dog, or a cow, or an animal with horns, and they probably just go there to play. They just touch the animals, and you're there literally peeing in your pants because your child has done something that you can never imagine yourself doing. They are not afraid of the cars on the road. They walk into the expressway and they literally take a stroll, a happy stroll. They're actually very obviously happy doing what they're doing. You're the one that is worrying, so they really do not have that awareness to danger. And that's obviously a case of not necessarily a low cortisol, but the fact that their brain is not processing the information as it should, and so it's not resulting to the release of cortisol into their bloodstream as much as is needed for them to realize there's something wrong and they should react to it. Number 7 is inappropriate crying or laughing. This is also very classical. Many moms talk about this. My child is just always laughing for no reason. I don't know what the hell is laughing. Or sometimes just crying. And you're wondering, why is this child crying? Your child could be going through a meltdown, and that's why it's crying. Now meltdowns happen when there's too much, it's sensory overload, there's too much inputs from different angles. There's probably hearing too much sound here, hearing too much, the smell is heightened, the sense of smell is heightened, there's a lot going on at the point. He's finding it so difficult, the brain is finding it so difficult to process all of these things at once, and so he breaks down into tears, and you're wondering why he's always having this all the time. It's sensory overload, mommy. It's sensory overload, daddy. That's what is happening to your child. And then constantly laughing too much. Well, science says one of the possible reasons that science has given is that your child is probably going through a case of yeast overgrowth. So there's probably too much of candida in his gut, and he probably needs to just treat that, you know. Sometimes also it may not just be about yeast overgrowth or candida. It could be that your child is reminiscing over what has happened in the past, especially kids that are into watching cartoons or, you know, holding on to tablets. They find themselves reminiscing or remembering what they watched earlier on, and they find it funny and they keep laughing over and over. Now they can't communicate that to you, right, verbally, but you know, it's probably what is going on over and over in their head. They're recounting this funny experience. Number 8, not pointing at objects or people. This happens very early on. At the age of 1, it's expected that by 15 months, maximum 18 months, your child should be pointing at objects, and then you realize that your child really isn't. This happened to me with my second child. I was a bit, I already had experience with my older child, so I knew, you know, the signs to look out for. So when he was 12 months old, and I noticed, because I was comparing him with a child that was born next door who was just about the same age with him, that was easy for me because I didn't have the, you know, milestones of the elder brother to compare the younger brother with, but I was able to compare his growth with that of my neighbor's child. And I noticed this boy was always pointing at me, and he was just about 11 months old. My son then was 13 months old, and I realized the boy was 13 months old, my son was 15 months old, and he was not pointing his fingers at me yet, or at anything for that matter. And I knew something was up. You know, I quickly looked it up on the internet, and I told myself we need to work on this. But that was when my awareness, you know, that my second child could be autistic started. As early as maybe when I was around 10 months, I started observing certain things. So that's why we got our diagnosis a lot earlier. Before the age of 2, I was really taking him out for checkups, and by 2 he got his diagnosis. So that's, you know, what to look out for. We are still working on it. It's still a work in progress, but you know, we are in a good space, and you know, we're praying for more improvements. But you need to be observant and see the signs and not throw them away as just subtle, you know, things. Number 9, another sign to look out for is that your child is really smiling or interacting with others. So they like to play by themselves. If you see them in the playground, they'd rather be by themselves. Or, you know, in crutches or in nursery school, you see that your child is always in a world of his or her own. Be mindful of that. That could be a sign as well, you know, in addition to other things we're talking about. That is one of the signs that we look out for. Number 10, your child is fixated on certain interests. It could be anything, like toys, like closing and opening the door over and over and over, and you're wondering, why does this child have this habit? You know, you probably take it for granted because you think it's what gives him or what gives them joy, you know. But when this child does some things over and over, then you know there's something wrong. For instance, another one that is very, you know, classical is when, you know, they're watching a cartoon on their tablets and they keep repeating a scene over and over and over. You know, they watch the scene, they rewind and watch it again, they rewind and watch it again, and they could do that, say, about 100 times within 10 minutes. Honestly speaking, yes, they can actually do things like that over and over and over and over, and then you're wondering why you, so, you know, it's not it's a way of sensory seeking. You know, they're actually enjoying what they are getting from, you know, how they feel from that thing they're doing, so they keep doing it over and over. It's a repetitive behavior, but it's something that they enjoy because it's feeling something like a void or making them feel more comfortable as they're doing it, you know. Sometimes could be explained as a form of steaming too, you know, something that you do repetitively. Steaming could also mean rocking you're rocking, to and fro, always playing with some strands of your hair, or just doing it repeatedly over and over, or chewing on something continuously. It's like a habit that they just keep doing repetitively. So that's another thing to look out for. Number 12 is loss of previously learned skills. This could come in any form. It could be a form of words. Your child was already speaking, singing nursery rhymes, and all of a sudden it's not talking again. Or your child could walk properly, and all of a sudden his gait is not very straight. He's walking in an inappropriate way. He's probably staggering over and over and stuff like that. There's something wrong with his gross motor skills. Even the fine motor skills could be a problem as well. So whenever you find a child experiencing a loss of previously learned skills, then that child is regressing, and it's a very, very major, I like to call it the dangerous sign, honestly, because every other sign looks like something that is gradual, but the fact that you're going backwards, like a setback, honestly, it takes a lot more to get back on track. It takes a lot more to get back on track. So I have also experienced one of my kids having the loss of previously learned skills, could speak and all that, and all of a sudden stopped speaking or stopped using words, and this lasted for many years. We had to keep working on speech and working on other areas, especially the guts and healing the guts, trying to improve the brain functionality, hoping that with time words will come. And yes, words started to come. Yeah, slowly, but yes, the fact that it started just before he clocked 7, and that was a great achievement, honestly. So we're just working on improving speech. Some other parents experience loss of gross motor skills, where their child cannot do things with their hands or with their legs as they used to anymore. It's that serious. It's really, really that serious, and very painful for any parent to experience. So these are the 12 signs, and I hope that this will help a parent or a caregiver or a school owner or whoever is in charge of children to help other kids identify or what may be wrong with the child, and to help parents or identify what may be wrong, or to help a child that may have this condition to get necessary appropriate attention or intervention. It's very important that you start off your child early enough on the necessary intervention. This is always the only solution, nothing else. Early intervention is always the key. Now, your child may have one or two of your child may exhibit a few of the signs, does not mean that the child has autism. As I said earlier, and as I said in the previous video, please get your child to an expert that can help identify if your child has autism or not. You can also check online. There's some online tests. I'll put a link down in the description below so that you can do some kind of test on your child. Just answer questions, that about 10 or 15 questions. You answer these questions on behalf of your child to know if your child may have this autism or not. And then from the responses, from the answers you get, just make sure you answer these questions as honestly as possible. From the answers you get, from the results you get, you will know what to do next, if you need to see an expert or not. It will be written out there for you. So thank you for watching this far. In the next episode, I would also be talking about the strange things done by autistic kids. Strange things, I'll talk about the 12 signs you can find in kids on the spectrum, yes, but there's some other strange things that people will call quirky. So yes, look out for the video. And then subsequently, we're also going to talk about what I mentioned in the first video, explaining social communication and social interaction, restricted and repetitive behaviors and activities, and lastly, sensory processing disorder. Those are the 3 major characteristics or 3 major features of autism as described by the DSM-5, the Diagnostic Statistical Manual for Mental Disorders, Volume 5. So thank you for watching this far, and I'll be expecting you in my next video. Bye.